If your finger and toes look like this, you might have a condition called Chilblains. I'm Dr. Hart Pinto, an actively practicing primary care doctor in the UK, and today I'm going to talk about Chilblains, how to identify it and the best way to treat it. Chilblains, also known as Pernio, are small, itchy and sometimes painful patches that can develop on your fingers or toes, usually several hours after exposure to the cold. The common symptoms people experience with chilblains are small, itchy areas on your skin, most commonly on your fingers or toes. Some people also describe the areas as painful or stinging. You may develop sores, blistering and swelling, and also changes in skin colour, with red or blue patches. So why do some people get chilblains? It's not entirely understood why some individuals develop chilblains and others do not. However, the condition is believed to arise due to an unusual response to cold exposure and the subsequent rewarming of the affected area. Wearing tight-fitting clothing and tight-fitting shoes in cold, damp weather can make you more susceptible to this condition. Additionally, there are a certain group of patients that are at higher risk of developing chilblains, and these include people who smoke, young women, particularly those between ages 15 and 30, people who spend a lot of time outdoors or work outside, those who live in cold and humid climates, individuals with family members who are also affected. If you have an affected family member, you may be almost 4 times more likely to be affected by this condition. If you suffer from peripheral vascular disease, and individuals with low body weight or poor nutrition, including those with anorexia nervosa. So how can we treat chilblains? In most cases, chilblains will go away on their own in around 2 to 3 weeks, provided that you avoid cold and damp weather conditions. To help things along, there are several things you can do to help your body heal. You should reduce your exposure to cold, damp conditions and other triggers, wear warm gloves and socks, avoid medications that might constrict blood vessels, and this includes caffeine, and if you smoke, stop. You may come across many different types of creams or lotions at your pharmacy. However, there isn't much evidence to support their use, so it's probably best to avoid them. So when should I see my doctor? If your chilblains persist longer than 2 to 3 weeks, you should seek an assessment from your doctor. Your doctor will be able to investigate for rarer underlying health conditions such as connective tissue disorders, such as lupus, and hematological conditions like malignancy, cryoglobulinemia, and antiphospholipid syndrome. If your chilblains are severe or chronic and do not respond to appropriate self-care measures, your doctor may prescribe you a medication. This is likely to be in the form of nifedipine, an oral medication that will help dilate the blood vessels. In the UK, this is an off-licence use of this medication. You may find that some doctors will still prescribe steroid creams such as betamethasone valerate. However, current guidance doesn't recommend their use, so you may find it less likely for a doctor to prescribe this for you. I hope you found this video useful. If so, why not share your experience with our community below and subscribe to our channel for more health tips.